Good afternoon, everyone. A warm welcome to our project guide Sindhu ma'am, project reviewer Victor sir, and Pratap sir. Last but not the least, I welcome you all to our project presentation. I am Mahin Mehtab Kehij, and my teammates are Shilpa, Ganavi, and Mohana. We are from batch 15 under the guidance of Sindhu ma'am. Our project is based on retinal disorder detection using machine learning. I am here today to give an introduction of our project presentation. The world is facing an unprecedented epidemic of diabetics. The IDF estimates that in 2015 there are 415 million adults with diabetic worldwide, or 1 in 11 adults, which is a world prevalence of 8.8% of the world's population who are living with diabetics. North America and Caribbean is the region with the highest prevalence rate of diabetics, with 11.5% people estimated to have diabetics. This is followed by the Middle East and North Africa regions, which has a prevalence rate of 10.7% people with diabetics. Next is the Southeast Asia region with 9.1% million people with diabetics. Western Pacific is the region with highest number of people living with diabetes. However, its prevalence is 8.8%, the same as the prevalence of the world. South and Central America has 9.6% people with diabetics. Europe has 58 million people, or 7.3% with the diabetics. By 2040, it is projected that there will be 642 million people, or 1 in 10 adults with diabetics. The biggest increase is projected to occur in the Middle East and Africa regions, where it is expected that the number of people with diabetics will more than double from 35.4 million in 2015 to 72.1 million in 2040. About almost 80% of diabetic cases occur in low or middle income countries. 35.8% of cases are undiagnosed in high income countries, 50% in low or middle income countries. 87 to 91% of cases are two-type diabetes. Two-type diabetes accounts for over 90% of all cases of diabetes. The increase in type 2 diabetic in low and middle income countries is associated with changes in lifestyle, culture, industrialization, and urbanization, increasing obesity, physical inactivity, and genetic factors associated with some indigenous people. As diabetic becomes more prevalent, so do associated complications such as diabetic retinopathy. Diabetic retinopathy can cause irreversible vision loss. Of the 415 million people worldwide with diabetic in 2015, over one third will develop some form of diabetic retinopathy in their lifetime, and a third of those will have impaired vision as a result. More than 93 million people currently suffer some sort of eye damage from diabetes. While advanced diabetic retinopathy can lead to blindness, the early stages are entirely asymptomatic. Further topic will be continued by Shilpa.
Thank you, Mahin. Problem statement. In low and middle income countries, poor health and health related expenses can be a catalyst for lifelong impoverishment. When health care is needed but delayed or not obtained, it may result in worse health outcomes and increases healthcare cost. People in low and middle income countries face a great threat for complications than those in wealthier countries, as they do not have access to adequate health support services. Blindness caused by diabetes can cause us a financial and social burden of eyes diseases on the poor, include a loss of earning capacity for those who become blind. As I previously mentioned, DR is currently the leading case of vision loss in working age adults, meaning people experiences DR in the prime of their wage earning years. There are few government social services in low and middle income countries to support those unable to work due to blindnesses. Therefore, obtain for supplementary incomes are limited. This as follows and affected for the family of those who become blind, as they are forced to service on reduced income. And we all know that women and girls suffers the most from all the problems I just highlighted. Impact on vision loss on the poor, less access to health support services, loss of earning capacity, loss of dependencies and dignity, need for greater social support. Women and girls suffer most. Further will be continued by Mohana.
Thank you, Shilpashri. I am Mohana. Effects of vision loss on a person. Not only blindness, but any degree of moderate to severe visual loss due to any causes affects the quality of life of people in a multitude of ways, including their psychological and physical well-being, their work and social integrations and independence. Blindness robs people of their independence and dignity and increases the need for greater social supports, and often this is in countries and localities where few options of specialized support for people with blindness exist. Everyone with diabetic is at risk of diabetic retinopathy. The worldwide rise of diabetics and its complex complications means there is an increased need for health professionals to consider the possibilities of diabetic eye disease even before the symptoms begin to show. Diabetic retinopathy may be asymptomatic until an advanced stage, and then it is often too late for effective treatment. Therefore, it is imperative to support people in managing their diabetic and to have regular examinations. People with diabetics need to be supported to play an active role in managing their diabetics by improving their blood glucose and blood pressure control. A person with diabetic can slow down the progresses of diabetic retinopathy. Objectives: to study various modulations of acquisition of fundus image, to study existence approach to the diagnosis of diabetic retinopathy, to compare the performance of proposed approach to the SOTA technique, and to develop a CDSS of a diagnosis of diabetic retinopathy from fundus image. Further explanation is continued by Ganavi.
Thank you, Mohana. The topic which is I'm going to do is existing system. The stages of diabetic retinopathy are classified in this table using the International Classification of DR scale. Ideally, screening methods should be identical in different resource settings, and the same sequence should be followed in both low resource and resource rich settings. As a minimum, managing eye health in people with diabetes should include medical history, comprehensive eye examination, which includes a visual acuity test, a retinal examination adequate for diabetic retinopathy classification, which would generally involve each retina being closely inspected for the signs of diabetic eye disease using one of the following methods, which is detailed on the next slide. Non-mydriatic retinal photography, binocular indirect ophthalmoscopy, mydriatic retinal photography, slit lamp biomicroscopy. This retinal photo shows the difference between a normal retina and a retina with severe non-proliferative diabetic retinopathy with the severe diabetic macular edema. Approximately one third of people with diabetes will have a diabetic retinopathy, and approximately one third of those will have formed diabetic retinopathy that threatens their vision and requires treatment. These photos demonstrate that timely referral is crucial to ensure early intervention. So next topic is proposed system. The stages of the diabetic retinopathy are classified in this table using the international classification of the DR scale. Timely treatment with the laser photocoagulation and or the use of anti-VEGF treatments, intravitreal administration of vascular endothelial growth factor inhibitors, or steroid treatments can prevent vision loss, stabilize vision, and in some cases even improve vision if performed early, particularly for DME. Thank you. Further topic is continued by Mahi.
Coming to the literature survey, Paper 1, title of the paper is Deep Image Mining for Diabetic Retinopathy Screening. Author are Gwenol Quelek, Katia Cherry, Yasin Baudi, Patrick Kochiner, Mauti Lamard. Journal, Medical Image Computing and Computer Assisted Intervention. Year of publication is 2017. Deep learning is quickly becoming the leading methodology for medical image analysis. Given a large medical archive, where each image is associated with a diagnosis, efficient pathology detects or classifies can be trained with virtually no expert knowledge about the target pathologies. However, deep learning algorithms, including the popular ConNet, are black boxes. Little is known about the local decisions at the image level. A solution is proposed in this paper to create heat maps showing which pixel in image play a role in the image level prediction. In other words, a ConVnet trained for image level classification can be used to detect lesions as well. A generalization of the back propagation method is proposed in order to train ConVnet that produce high quality heat maps. The proposed solution is applied to diabetic retinopathy screening in a database of almost 90,000 fundus photographs from to 2015 Kaggle diabetic retinopathy computation. In conclusion, a general framework was proposed for solving multiple instance problem with ConNet, and the relevance of this framework was demonstrated in the context of DR screening. Coming to the next paper, paper 2, title of the paper is Diabetic Retinopathy Detection Using Deep Learning. Author is Kwang Ramaswamy Muthuraman, Lakshman Singh, Gopa Sen, An Tran, Bin Mathway Chow. Journal, the Fourth International Conference on Machine Learning and Soft Computing. Year of publication is 2020. Diabetic retinopathy is an eye disease associated with chronic diabetics. The automated method of diabetic retinopathy screening will speed up the detection and decision-making processes, which will help to control or manage diabetic retinopathy progression. This paper presents an automated classification system in which it analyzes fundus images with varying illuminations and fields of views and generates a severity grade for diabetic retinopathy using machine learning models such as CNN, VGG16, and VGG19. This system achieves 80% sensitivity, 82% accuracy, 82% specificity, and 0.094 AUE for classifying image into 5 categories ranging from 0 to 4, where 0 is no diabetic retinopathy and 4 is proliferative diabetic retinopathy. Further papers will be continued by Mohana.
Thank you, Mahin. Paper 3, title of the paper, Improved and Robust Deep Learning Agent for Preliminary Detection and Diabetic Retinopathy Using Public Datasets. Author, published by Elsewhere BV. Journal, Intelligence-Based Medicine. Year of publication 2022. Diabetic retinopathy is one of the leading causes of preventable blindness in the working age diabetic population in India and across the world. It may lead to permanent blindness if not detected in the early stages. The prevalence of diabetic retinopathy among diabetics in India was 10% to 16.9% in 2014 and 2019 respectively. In 2019, The International Diabetic Federation estimated the diabetic will affect 101 million people in India in 2030, the largest number in any nation in the world. Our work is an attempt to speed up preliminary screening of diabetic retinopathy to the future requirement of such as huge amount of diabetic patients. In this paper, we also discuss challenges of automated detection in medical image using CNNs, such as use of public datasets for training, pre-processing method, performance for unbalanced classes. Next, paper 4, title of the paper, Automatic Screening for Diabetic Retinopathy in Internet Fundus Image Using Artificial Intelligence. Author published by Elsewhere BV. Journal Intelligence Based Medicine. Year of publication 2020. The Department of Deep Learning Technology and High Performance Computer in recent years has established scientific improvement in the accuracy of image, and efforts are currently being made towards the development of ophthalmic artificial intelligence. In this study, deep learning was applied to fundus image analysis. The fundus image were automatically classified by their severity index, and the recognition accuracies for Japanese and Americans data were compared. We trained a deep convolutions neural network and a support vector machine using a data sets consisting of 35,126 open sources American clinical fundus image, which were graded for diabetic retinopathy by licensed ophthalmologist. Further explanation is continued by Ganvi. Further explanation is continued by Shilpa Shri.
Thank you, Mohana. Paper 5. Title of the paper, Extensive Analysis of Machine Learning Algorithm to Early Detection of Diabetic Retinopathy. And the author, Shivashankar Reddy, Neelambar Sethi, Rajender, Gadiraju Mahesh. And the journal, Material Today. And the year of the publication, 2020. In today's world, disease diagnosis plays a virtual role in the area of the medical imaging. Medical image is the method and procedure for making visual description of the interior of the body of clinical investigation and clinical medication, as well as visual depletion of the function of some organs or tissues. Medical imaging also deals with disease detection. Better view is obtained to detect the disease by using machine learning in medical imaging. It mainly focuses on the development of computer program that can assess the data and use it for themselves. In this work, the focus will be on detecting a diabetic retinopathy using machine learning. Diabetes is the type of disease that results in too much sugar in body. Diabetic retinopathy is one of the main side effects of the diabetes. Coming to the paper 6, the title of the paper, Automated Detection and Diagnosis of Diabetic Retinopathy, a Comprehensive Survey. And the author, Vasudevan Lakshmi Narayan, Arya Sarkar, and Janathanam Jyoti Balaji. And the journal Imaging, year 2021. Diabetic retinopathy is the most cause of irreversible visual and blindness on worldwide. DR is due to chronic high blood glucose level, which causes retinal capillary damage and mainly affects the working age populations. DR begins at the middle level, which no apparent vision symptoms, but it can progress to the damage of the blindness. Thus, early diagnosis and regular screening can decreases the rise of visual loss to 55%, as well as decreasing the cost of treatment. DR is clinically diagnosed through observation of the retinal funds, either directly or through imaging techniques such as fundus photography or optical coherency tomography. And further will be continued by Ganvi.
Thank you, Shilpa. The paper which is I'm going to present is paper 7, automated segmentation of exudates, hemorrhages, microaneurysms using single convolutional neural network. Author Zen Hong Tan A, Hamido Futijabi, Shobha Shivaprasad C. General, Department of Electronics and Computer Engineering, NGEE ANN Polytechnic, Singapore. Year 2017. Diabetic retinopathy is an eye disease associated with chronic diabetes. DR is the leading cause of blindness among working age adults around the world and estimated it may affect more than 93 million people. Progression to vision impairment can be slowed or controlled if DR is detected in time. However, this can be difficult as the disease often shows few symptoms until it is too late to provide effective treatment. Currently, the detecting DR is time consuming and manual process which requires an ophthalmologist or trained clinical to examine and evaluate digital color fundus photographs of the retina. To identify the DR by the presence of lesions associated with the vascular abnormalities caused by the disease. The automated method of DR screening will be speed up the detection and decision making process which will help to control or manage DR progression. So next will be the paper 8, diabetic retinopathy detection through deep learning techniques. Author Wijdan L. Wafa, General Information Technology Department, University of King Abdul Aziz, Saudi Arabia. Year 2020. Diabetic retinopathy is a common complication of diabetes mellitus which causes lesions on the retina that affect the vision. If it is not detected early, it can lead to blindness. Unfortunately, DR is not reversible process and treatment only sustains vision. DR early detection and treatment can significantly reduce the risk of vision loss. The manual diagnosis process of DR retina fundus image by the ophthalmologist is time, effort, and cost consuming and prone to misdiagnosis like computer aided diagnosis systems. Recently, deep learning has become one of the most common technique that has achieved better performance in many areas, especially in medical image analysis and classification. Convolution neural networks are more widely used to deep learning method in medical image analysis and they are highly effective. For this article, the recent state of the art method of DR color fundus image detection and classification using deep learning techniques have been reviewed and analyzed. Furthermore, the DR available dataset for the color fundus retina have been reviewed. Different challenging issues that require most investigation are also discussed. So the next topic is discussed by Mahim.
Coming to the literature survey, coming to the survey findings, Based on available literature, the followings can be inferred. Diabetic retinopathy is a life-threatening condition that requires a detailed diagnosis. There are numerous deep learning approaches proposed that make it difficult to decide on which work better and in what scenario. Machine learning or deep learning models are still immature to handle the complexity of the screening process, although some deep learning models are able to perform closer to the SOTA. It will never replace ophthalmologists. Some of the references are, thank you.